Okay, my name is Kelsey Wade, and this is Thea Lefebvre, and our Zoonosis presentation, that the topic we picked was rabies.
Okay, so some history on rabies. The first reference of rabies is 4,000 years ago. And for hundreds of years, people obviously were aware of rabid dogs and tried to come up with cures for the disease, but there was no effective treatment for rabies until Louis Pasteur in the 1800s, and he was able to use the dried spinal cord of an infected animal to create an effective vaccine.
So rabies is spread when an infected animal's mucus comes in contact with an uninfected individual's mouth or open wound. This is typically done by scratching or biting. Domestic dogs are actually the main source of humans acquiring rabies. They account for 99% of the deaths with humans. But rabies can also be passed from other wildlife as well. When infected, rabies actually impacts the central nervous system and can be completely fatal if not treated immediately and actually before symptoms start to occur.
Okay, so the disease itself, it's a bullet-shaped virus, and it binds onto the receptors of a muscle cell and then invades the cell. And then it will replicate inside of the cell and burst out and then go on to infect a person's neurons and travel through the nervous system until it reaches the brain. And that's when death can occur. So the symptoms of rabies are hydrophobia, which is fear of water, foaming at the mouth, aggression, confusion, and then death is usually caused by cardiac or respiratory arrest. There are two different types of rabies. There's furious rabies, which is what you usually think of, as well as paralytic rabies, which just causes the body to be paralyzed and does result in death as well. So about 70% of cases are furious and 30% are paralytic.
Rabies is a worldwide disease and it impacts so many different nations. But Asia and Africa cover 95% of cases of rabies. So there is a higher concentration of rabies in those two areas. And low-income communities and nations are the ones that seem to be impacted the most. As Thea mentioned, the vaccine is kind of that main source of relief when it comes to rabies, prevention and cure. And the reason that these low-income nations are the most vulnerable is because they don't typically have access to that vaccine. And then children between the ages of 5 and 14 are also mostly impacted by the disease as well.
Okay, so incidence and prevalence. Today there are usually about 59,000 deaths per year due to rabies, and 95 of these deaths occur in Asia and Africa, while North and South America are usually unaffected, except for the US. It seems like America does have a large issue with rabies, usually through canines and bats. Canine rabies is obviously the biggest issue due to the number of infected stray dogs. But in first world countries, bat rabies is also a prevalent issue. And the post-exposure prophylaxis, or the vaccine, after a person has been bitten is nearly 100% effective. So the biggest issue is access to care and getting that vaccine.
So being diagnosed with rabies is actually extremely hard. There isn't any diagnostic tool available in clinics where you can go to a doctor's office and have them test you to see if you have rabies. It's a huge, long, drawn-out procedure to be able to test you. And so what they've typically done is they've categorized people's interactions with a potentially rabid animal into 3 different categories, and that's how they would diagnose you with rabies. So category 1 is when someone comes in contact with a potentially infected animal and the animal is licking them, they're feeding the animal, and so forth. There's no broken skin and there's no true exposure to the disease. Category 2 is a little bit more extreme. This is if the potentially infected animal bites or scratches just a little bit. There's no broken skin in a category 2, and there's no bloodshed, no bleeding, but there is a little bit more exposure to rabies in general. And then a category 3 is what people typically would envision as being infected with rabies, is an an animal, it bites or scratches someone, it breaks the skin, there's an open wound, saliva gets from the infected animal into the wound, and this would be an extreme exposure for the individual and the disease.
Okay, so treatment. As we've mentioned, the most effective treatment is the post-exposure prophylaxis. It's the vaccine that has to be administered before clinical symptoms begin to appear, because if symptoms are already present, that means that the disease has reached the brain, and there's really not an effective treatment of rabies. In some cases, doctors do use immunoglobulins in order to help the person recover a little bit, but that's not really a super effective treatment, although there is a case of a woman who recovered from rabies completely just off of immunoglobulins, but that's like an extremely rare case.
So prevention is that vaccine. The vaccine is dire to preventing rabies. And so the first vaccine was created in 1885 by Louis Pasteur and has continued to evolve and develop since then, but then also vaccinating your dogs. That is also very, very critical to help slow the spread of rabies in general.
Yeah, so in conclusion, rabies is a pretty terrifying disease with a very high mortality rate. But the best way to address this disease is by supporting vaccination efforts for canines and susceptible wildlife such as bats. And that's what most organizations working to prevent rabies are doing, is making sure to vaccinate any stray dogs or wildlife. And with rabies, it is always better to be safe than sorry. If you've come into contact with a rabid animal or have been bitten, it's important to get vaccinated as soon as possible because waiting can be deadly. And then here are resources.